I felt like I was drugged. It doesn't seem real because I don't remember.
It was like she was possessed.
We were baffled. We could not understand why it was now spreading.
More and more, I had pain, excruciating heat and excruciating cold.
I froze for a second. I remember thinking, she's dead.
Next, two medical mysteries that defied the experts. When Kristen Gunther begins suffering from bizarre delusions, doctors fear she may hurt herself, or even worse, another patient.
It's like somebody's telling me a story about someone else.
I never felt so helpless in my life because I didn't know where to turn.
Then, on a seemingly ordinary day, Mark Chernick wakes up to find that his feet don't look anything like they should. Little does he realize his life is about to be turned completely upside down.
I'd never seen anything like it before. It was all the way up to his ankles. It looked like his feet were dead.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. When environmental consultant Roger Gunther met Kristen Danuski through an online dating service in 1998, he felt an instant connection with the 26-year-old music store clerk.
As soon as I met Kristen, I knew that we were destined to be together.
It didn't take long for Kristen to arrive at the same conclusion, and less than 3 years later, they were married in Clymer, New York.
We're very much in love. We're best friends. Our house was full of happiness and fun.
Both Kristen and Roger were also eager to start a family, and in October of 2003, their son Owen was born.
I always wanted to be a mom. It was always just a dream of mine to have a baby.
We had everything that we had ever wanted at that point, and couldn't imagine ever being any happier than that.
Shortly after Owen turns 2, Roger and Kristen decide to move to Delaware to be closer to both their families.
It was a pretty magical time for us, being in a new place and just being together.
But just a few blissful months after settling in, Kristen wakes up one morning feeling very strange.
I would have high anxiety. I felt like I was going crazy and was having a really hard time calming myself down.
Over the next 2 days, Kristen does her best to manage her growing anxiety. But Roger doesn't realize how bad her mental state has become until one afternoon when she calls him unexpectedly at work.
I picked up the phone. She hesitated when I said hello, like she was struggling to find words.
I got really confused. I didn't know who I was talking to.
She said to me in a very groggy voice, "Can you please come home?" I grabbed my stuff off my desk and ran out the door.
I felt like I was drugged. I was very confused. It just was like a switch flipped in me.
A half hour later, Roger comes in through the front door of his home, and he's greeted by a shocking sight.
What I saw was Chris's feet. They were sticking out of the bathroom, and they weren't moving. I froze for a second, and I remember thinking, she's dead. I made her look at me, and her eyes wouldn't focus on me at all. And she was trying to speak and couldn't. I grabbed my cell phone, I called 911.
While the paramedics rush Kristen to the nearest hospital, Roger wakes 2-year-old Owen from his nap and heads directly to the medical center. But once at the ER, Roger is shocked to find his wife on a gurney, all by herself.
She hadn't been seen yet by a doctor. When I called to her and touched her shoulder, she didn't react, she didn't respond, and I was really alarmed.
Frightened as he is, nothing could have prepared Roger for what happens next.
I looked at her eyes, and her eyes were rolling back. Her face was trembling and twitching. It looked like she had been plugged into a light socket. I yelled out, "She's having a seizure."
Suddenly, the medical staff is on high alert.
They put a bite block in her mouth, and very quickly she was sedated. They intubated her and then just took her away. It was the most horrifying thing I had ever seen in my life.
While Roger waits anxiously, doctors take a CAT scan of Kristen's brain. 2 long hours later, the results come back, but they raise more questions than answers.
They came to the conclusion that she hadn't had a stroke, and they didn't have a good indicator that she had any kind of a brain tumor. So they started looking for other things. They did run an MRI, and when the MRI results came back, there was what they called an abnormality. There was a fuzziness, just sort of an area of maybe swelling or inflammation right smack in the middle of her brain.
The doctors suspect that the abnormality is an infection, and they immediately run a battery of tests to confirm their hunch. In the meantime, Kristen seems to have stabilized on her own, but the episode has clearly taken a toll.
She looked a little pale and a little exhausted, and she didn't really remember much of how she had gotten to the hospital.
I remember them wheeling me into the doors, being on the gurney in the hallway, but I don't really remember anything else from that day.
The next 3 days seem to go by in slow motion as Kristen and Roger anxiously wait for the test results.
We were both hopeful at that point that they were going to find something, and, it would be a course of antibiotics or something, and she would be fine again.
Finally, the findings are in. Kristen's white blood cell count is on the high side, a typical symptom of viral meningitis, an infection of the meninges, the thin lining that covers the brain and spinal cord. There's no treatment for the disease, but the body's immune system can usually fight it off on its own. Patients just need rest, fluids, and plenty of pain relief.
I remember thinking, well, she'll recover from it. She'll be sick for a couple of weeks, and we'll all be okay.
The doctors find Kristen's seizure baffling, but suspect it's in some way linked to the meningitis. They put her on anti-seizure medication just to be safe, and after a week, a worn-out Kristen returns home to complete her recovery.
They basically determined that she needed to follow up with her family doctor.
But just when the Gunthers think they've turned a corner, Kristen experiences an alarming setback. At 3 a.m. that morning, Roger is startled by the sound of his wife crying.
At first thinking maybe she's just having an anxiety attack, she said, wait a minute, why am I here? How come I'm not in the hospital? How did I get home? I don't remember getting home. It was terrifying. All I could think of was I need to get her to the hospital. I was really scared.
After collapsing and experiencing a horrifying seizure in the ER, doctors diagnose Kristen Gunther with an infection of the brain. But when they send her home to recover, she begins to suffer from terrifying delusions that land her right back in the emergency room.
We're right back to where we were a week ago. I found myself standing there without any idea of what was going on.
After examining Kristen, the ER doctor decides she's having a bad reaction to the anti-seizure medication and hooks her up to an IV to flush the drug out of her system. But as they wait for the treatment to take effect, Kristen's behavior grows stranger and stranger.
She was agitated and confused and angry. Her face was set with angry lines, and she was speaking very quickly, saying, where am I? Why am I here? Why am I sitting on this table? And it was increasingly paranoid and just very psychotic type of behavior. And the doctors came to the conclusion that it was not a reaction to the medication, that there was something else going on.
Doctors administer a sedative to calm Kristen down. But it's clear to Roger that no one on the medical team has any idea what's causing the bizarre behavior.
The doctors were still proceeding under the assumption that it was some form of brain infection, and maybe they just had missed something. They were too narrowly focused on meningitis, and they were looking for any kind of infectious agents whatsoever that could somehow affect the brain. This is when they started running just an enormous battery of tests. I knew that they were clutching at straws and just trying desperately to find anything that could fit.
Over the next week, more than 7 specialists examined Kristen, to no avail. With each passing day, her mental condition continues to deteriorate. She seems to grow more confused by the hour, and it isn't long before her aggressive behavior gets out of hand.
She managed to get out of her bed. She disconnected her IV and left the room and entered the room of another patient, accused the person of trying to injure her in some way, and at that point she had to have a babysitter in her room. She was strapped down to her bed. It was horrifying to watch. There was nothing I could do.
To control her violent outbursts, Kristen is also kept constantly sedated.
When she would wake from her sedation, she would scream, she would babble, she would talk to people who weren't there. It was like she was possessed. I couldn't communicate with her. No one could.
It's like somebody's telling me a story about someone else. It doesn't seem real because I don't remember.
To make matters worse, test after test finds absolutely nothing wrong with Kristen.
There just wasn't an answer. It was becoming clearer and clearer that the problem was something beyond the knowledge of these doctors.
Then, 2 weeks into her hospital stay, Kristen begins to have trouble breathing.
And I came in and she had an oxygen tube under her nose, and I was alarmed and asked what was going on. They told me that her breathing rate was slowing down and she was no longer able to speak. She was not responsive at all at this point.
The next day, Kristen takes a sharp turn for the worse. Her heartbeat drops to a dangerously low 30 beats per minute, and she's immediately moved into the intensive care unit.
I remember feeling helpless and angry and just saying, "Please fix my wife." I started to think, this is it. She's slipping away from us, and there's not anything any of us can do to stop it.
When the doctor comes in to check on Kristen, he takes Roger aside and tells him something no husband ever wants to hear.
He turned to me and said, "You need to prepare yourself for the fact that your wife is either going to die or she's going to be in a persistent vegetative state for the rest of her life." I never felt so helpless in my life as I did at that time, because I didn't know where to turn.
"34-year-old Kristen Gunther has been suffering from a terrifying disease that no doctor can identify. Over the past month, she's deteriorated mentally, experiencing memory loss, extreme confusion, and violent paranoia. Now she can no longer breathe on her own, and her heart rate is dangerously low.
I remember thinking, I'm not going to have the love of my life with me anymore.
With Kristen fading by the moment, the doctors take one last stab at making a diagnosis. They methodically go back over every test result, desperately searching for a clue.
The only thing the doctors had to point to was this MRI of her brain. They started to think maybe there's a tumor in there. We just can't see it because it's so deep. So they made a decision to send her to a research hospital in Philadelphia.
In less than an hour, Kristen is rushed by helicopter 40 miles away to the hospital at the University of Pennsylvania. Dr. Joseph Dalmau, a neurologist, is called in to take on the perplexing case.
I knew that an MRI pointed that she had an inflammation in an area of the brain that's called limbic system.
Unlike the doctors at Kristen's local hospital, Dr. Dalmau doesn't think a brain tumor is what's causing her body to go haywire. However, he's immediately drawn to Kristen's very high white blood cell count.
Increase of white blood cells goes along with the presence of inflammation. Any injury to the brain tissue and results in an inflammation. Injury can be caused by a trauma, by a virus, by an infection, or can be caused by an autoimmune response against the brain. Considering the age of the patient and the symptoms, we suspected an autoimmune disorder.
To confirm his hunch, Dr. Dalmau immediately orders a specialized blood test and a spinal tap. If Kristen has an autoimmune disease, infection-fighting cells called antibodies will show up in her blood and spinal fluid.
The results of both tests were positive. The patient has these antibodies.
I remember him saying, "We think we know what's wrong with your wife," and just being flooded with relief that they knew what was wrong.
When the patient has these antibodies, the patients frequently have a tumor that's called a teratoma. A teratoma is a tumor that is composed of many tissues in the body. These tumors contain, for example, fat, or contain skin. They can even contain teeth, brain tissue.
What causes this particular species of tumor to grow inside the body is unknown. But if Kristen indeed has a teratoma, Dr. Dalmau will be one step closer to solving her case.
In this scenario, we were very suspicious that the patient could have teratoma in the ovaries. For reasons that we still don't understand, teratomas are frequently present in the ovaries.
Dr. Dalmau immediately orders a series of CAT scans and ultrasounds to search for the ovarian tumor.
I was very nervous while waiting for the results to come back, so we sat around and waited for the phone to ring again. And the call came back, and they said, "We found the tumor."
The CT scan and the ultrasound demonstrated a small tumor in the left ovarian region.
The tumor is the size of a golf ball, and it's the critical clue Dr. Dalmau has been looking for.
Based on the demonstration of the antibodies and subsequently on the demonstration of the tumor, this was the confirmation of this diagnosis, anti-NMDA receptor encephalitis.
Anti-NMDA receptor encephalitis is an autoimmune disorder in which the immune system attacks structures in the brain called NMDA receptors. In a healthy individual, the immune system fights off infections. But in patients like Kristen, the immune system malfunctions, attacking the NMDA receptors. This in turn results in emotional and cognitive impairments, as well as problems with respiration and heart rate.
We don't have an idea what triggers this immune response in these patients. The NMDA receptors are critical for the function of memory, learning, behavior, cognition, and disruption of the receptors affect all these functions.
All of these medical difficulties seem to be illuminated by this one light, and I was really cautious with myself about not getting overexcited, but it was almost impossible not to.
Dr. Dalmau explains that in Kristen's case, the disease was triggered by the presence of the tumor in her ovary. He suspects the growth contains brain tissue, and that's what's been confusing her immune system all along.
The presence of this tumor triggers an immunological response. This immune response attacks the brain of the patient.
That brain tissue just happened to be exactly the same as the brain tissue in that part of her brain where the fuzzy image showed up. So rather than being a tumor or any kind of infection, it was her body attacking her own brain.
As the wires in her brain got crossed, vital organ systems in Kristen's body became seriously disturbed.
They can explain the breathing problems, the problems controlling the heartbeat. We know that the disease can be lethal.
Kristen's startlingly rapid mental decline is also typical of the disease.
Sometimes there is an increasing anxiety, and this evolves towards a change of mood and behavior and personality. The patient does not remember anything for weeks, sometimes for months.
I didn't realize that I had been out of it for 2 months. It seemed like days for me. I didn't know where our son was, where I was,
It's a blessing that she has no recollection of the really horrid things that happened.
But as it turns out, one of the most terrifying moments, Kristen's initial seizure in the ER, wasn't what it seemed at all.
She had some abnormal movements that happens frequently with this disease. Sometimes this can be mistaken for seizures.
With Kristen still in critical condition, she's immediately scheduled for surgery to remove the teratoma from her ovary.
I do remember asking him at the time, was there a likelihood that the tumor might be cancerous? And his response was, yes, there is a possibility of the tumor being cancerous. I was really scared, and I didn't know what to do.
Kristen Gunther has just gone into surgery to remove a life-threatening tumor from her ovary. Now, the family is anxiously waiting to find out if the growth is cancerous.
When the pathologist examined the tumor tissue, it turned out that it was a cancerous type of teratoma.
I felt like somebody had punched me in the gut.
But despite the difficult news, doctors assure Roger that the cancer hasn't spread, and Kristen's prognosis is good.
This is a type of malignant tumor that responds to the chemotherapy, and many patients get cured.
But before they can even deal with the cancer, doctors must treat the autoimmune disease that has been eating away at Kristen's brain. For that, Dr. Dalmau explains a plasma exchange will be necessary.
The plasma exchange is a procedure in that the fluid of the blood that contains the antibodies is filtered through a machine that gets rid of these antibodies.
With the rogue antibodies removed from the bloodstream, Kristen's brain should start to recover. And within just 10 days, Roger begins to see a change in his wife.
And I grabbed her hand, and she squeezed my hand. And I asked her, I said, do you know who you are? And she said, in a very, very hoarse voice, she said, Kristen. And I knew she was gonna be okay.
It was confusing when I first came to see myself hooked up to everything. I remember the first time I saw myself in a mirror was really scary. I didn't even connect that it was me, that I was looking at myself.
After 3 challenging months in the hospital, Dr. Dalmau gives the family the news they've been praying for. The plasma exchange has eliminated the antibodies from Kristen's body. She can now safely begin chemotherapy.
Going to the chemotherapy was exhausting, but it wasn't nearly as bad as I would have expected it to be.
9 weeks later, the doctors pronounce Kristen cancer-free.
There was that moment of euphoria and just knowing that it was solved, or feeling that it was solved, and that she would be back to 100%.
Now that they can see the light at the end of the tunnel, the Gunthers can't help but wonder why Kristen had to come so close to death before doctors could pinpoint the cause of her problems.
This disorder is relatively new. By the time that the patient was diagnosed, I believe we had diagnosed around 14 patients.
But with the underlying cause, the tumor removed and the antibodies eliminated, the disease is definitely gone for good.
She doesn't need to be very concerned about this disease coming back. Her neurological function is 100% back to normal.
Today, 2 years after the grueling experience, Kristen, Roger, and Owen are the carefree family they once were, and that Roger feared they'd never be again.
Life today is just as crazy and hectic as it ever was before. Kristen's working pretty much full-time at a daycare now. Owen's in kindergarten. I want to spend as much time as I can with my wife and my son and not take for granted any of the things that happen.
I'm completely symptom-free now and completely healthy. I'm most grateful for all of the care that I was given. I'm very grateful that my husband didn't give up. I wouldn't be here if he didn't fight for me. It's like having another chance at life.
While Kristen Gunther's decline was sudden and devastating, Mark Chernick found himself facing a mysterious condition that seemed to be taking his life apart piece by piece. In 2001, 43-year-old Mark Chernick was living happily in a small town in western Pennsylvania. At the center of his life was his family, his wife Sheila and their children, 10-year-old Keith and 1-year-old Sarah.
I was a very happy, active person, and I loved my family very much. There's nothing better than a home-cooked meal and being with my kids and going to church on Sunday.
We would have dinner at night and take a walk around our neighborhood at night. We used to take the kids camping. He was very, very active.
He loved to ride his motorcycle. He was very, very big on the outdoors, and he was outdoors a lot.
While Sheila stays home with the children, Mark spends much of his time behind the wheel as a truck driver for a food delivery service.
I was driving close to 2,000 miles a week.
Mark often has to drive long hours and keeps himself alert by smoking, a habit he's enjoyed for most of his life.
If I was driving into New York City, for instance, with a tractor trailer, I might smoke more than a pack.
Then, one day in the summer of 2001, Mark steps out of his truck and notices a strange feeling in the ball of his left foot.
I had this pressure there like I was actually standing on a ball or perfectly round rock. I pulled off my shoe and checked. I found nothing in my shoe. I looked in my socks. There was nothing there. I thought it was weird, and I didn't think too much more of it.
But the bizarre sensation doesn't go away.
Every day it seemed like it was getting worse. I didn't know what to think.
And before long, he begins to feel it in his right foot as well.
We were baffled as to why it went from one foot to the other and there was no injury. We could not understand why it was now spreading.
Then, for no apparent reason, the strange feeling in his feet disappears, and both Mark and Sheila breathe a big sigh of relief. But only days later, while he's making a delivery, a troubling new development emerges.
There was a distinct feeling of needles rushing over your skin, or as if you were brushing yourself against a thorn bush, just like walking on real fine razors.
Mark struggles to make it through the rest of his route, and by the time he's done, his feet are throbbing in pain. The second he gets home, he rips off his shoes and is met with a shocking sight.
My feet looked like they had deep red and white blotches. It was covering my feet over the toes and down the back sides of my heels. I was flabbergasted. I really didn't know what to think.
A few days later, Mark checks in with the family doctor, who carefully examines both of his feet.
My doctor pushed on my feet with her hand and noticed that when she pressed down, the color would turn white, and if she let go, it would turn red.
It doesn't take long for the doctor to develop a theory. She suspects that Mark is suffering from a nerve disorder that could be the result of diabetes, a condition that can cause both foot pain and discoloration.
I was in shock when they said it could be diabetes. We'd never dealt with anything like that in the family before.
To confirm the diagnosis, the doctor sends Mark's blood out for testing, and the Chernicks head home to wait for the results.
We were very anxious to find out if that was what it was. We sat waiting for the phone call.
One long week later, the doctor's office calls with the lab report.
When the test came back that I was negative for diabetes and I still had the problem with my feet, I didn't understand what then could it be causing the problem.
Frustrated, Mark does his best to grin and bear it. But over the next few weeks, the pain gradually intensifies.
Mark would say that it felt like he just put his foot in a light socket. You could see the pain in his face. His whole face would just contort. His body would tense and his legs would shake, and you could tell there was something happening.
I persevered with my job, and I continued to feel the pain.
Then, just as he's beginning to wonder how much more he can take, Mark begins to experience a bizarre new symptom in his feet.
And they would just go from extremely cold to extremely hot and never stop in the middle. I would be laying down with my feet outside the covers, and all of a sudden they would turn cold, and I would put them under the covers, and they'd all of a sudden turn to fire.
You could touch it, and you could feel the temperature change. It was a dramatic change.
But just a few days after the onset of the temperature fluctuations, Mark wakes up to a sight that sends him reeling.
I looked down and realized that my toes were blue. I was astonished. It felt like rivers of cold water running through my feet. I was scared. I was very scared of what was happening to my feet.
For the last 5 weeks, Mark Chernick has been experiencing a bizarre constellation of symptoms in his feet, including intense pain and the sensation that they're either freezing or burning. And just when he thinks it can't get any worse, a terrifying new symptom emerges.
His toes were visibly blue. I couldn't figure out what was going on with it.
It was incredibly bizarre to me because I always took very good care of my feet.
Mark immediately makes an appointment with a local podiatrist, but he too is shocked by the appearance of his feet.
They were baffled. They didn't know what the blue was.
Hoping to at least alleviate the pain, the podiatrist gives Mark a steroid injection.
There was the hope that maybe this is the thing that's going to make it better. Maybe this is our cure.
With new optimism, Mark returns to work the next day. But as he's driving his truck down a busy highway, he has what can only be described as a near-death experience.
I got an electrical shock that just flew through my right foot, and I almost hit the gas and ran into the car in front of me. I had to stop and pull myself together and pull my feet off those pedals.
I was scared to death to have him out there driving.
When you're driving those big semi-trucks with the loads in the back, that's a lot of weight going at 70 miles an hour, and people could be killed. He could be killed.
Reluctantly, Mark concedes that he's endangering himself and everyone else on the road. On a cold day in November of 2001, only 2 months from the onset of his first symptom, Mark makes one of the most painful decisions of his life.
It was very difficult for me to leave my job. I was very upset.
It was devastating for Mark to not be able to work anymore.
I was in the eye of the storm. I couldn't do anything but sit there and watch it. Just kept falling apart around me.
Mark signs up for unemployment, which is just enough to keep the family afloat. Meanwhile, Sheila registers for nursing school.
Someone had to take care of our family. My husband was in too much pain.
It felt much worse when the weather turned colder, and it felt as if the pain was unbearable. I had no relief anymore. It was 24 hours and 7 days a week. It affected my walking to the point where I was dragging my feet.
Desperate for an explanation, Mark visits doctor after doctor, but to no avail.
No one seemed to be able to help Mark. He had MRIs, he had CAT scans. Doctors didn't have a clue as to what it was. They didn't always see the color changes. By the time we could get an appointment, his feet looked perfectly normal.
I was desperate for answers because half the people that I met thought I was crazy.
They basically said, we don't know what it is, take the pain medication, stay off your feet, elevate your feet, do whatever you can that makes it feel better.
And while each new doctor prescribes various pain medications, nothing seems to ease the relentless agony.
We tried everything. Anything you can imagine as far as pain relief or pain diversion. He would try to massage his feet to make him feel a little bit better. He would get up and move around. He would try soaking him in water. He would try putting him on ice. Anything he could do to trick his mind so then he didn't feel the burning pain.
No matter what I did, I never had relief. More and more, I had pain. Excruciating heat and excruciating cold.
He wanted to curl up in a ball and die. He didn't want to even talk to me anymore. He would sleep for 18 hours a day. He didn't want to face the world. He wanted to play with the kids, but he couldn't because he was in pain.
It was like a never-ending battle for him.
Then, one Saturday night in January 2003, the situation comes to a head. Mark's pain is worse than ever, and when he looks down, he can see it's not only his toes that are blue.
I looked down and I saw that my feet had turned blue. I said, Sheila, look at this. And my wife looked at that and said, oh my God.
I'd never seen anything like it before. His feet were a blue-gray all over. It wasn't just his toes, it was all the way up to his ankles.
I was absolutely astounded, and I told Sheila, just take him to the emergency room. There's got to be something seriously wrong.
It looked gruesome. It looked like his feet were dead.
For the last 2 years, Mark Chernek's toes have been bizarrely discolored and have left him in excruciating pain. But now, both of his feet have turned completely blue.
I was very upset and afraid.
In the emergency room, the on-call doctor performs a meticulous exam. She's never seen anything like Mark's blue feet before. Suspecting a circulation problem, she checks his blood flow very carefully.
His blood pressure was great. Pulses were fine. His heart was fine. Everything seemed to be fine.
Baffled, the doctor gives Mark a narcotic for the pain and discharges him just 2 hours later.
We had so many questions that weren't being answered. We were devastated that we could not get a name for this problem that he was having.
Over the next year, Mark takes daily doses of prescription narcotics, but he continues to suffer from severe and chronic pain.
I felt that I was going to have to live with this for the rest of my life, and I would be in total misery from this day on.
He never smiled. He didn't laugh anymore. He didn't even enjoy life anymore.
What happens when he can't walk anymore? You have visions of pushing my husband around in the wheelchair. It's a scary thought.
Meanwhile, Sheila finishes nursing school in 2004 and gets a job at a local hospital. In her free time, she begins searching for some clue as to what could be causing Mark's strange condition.
I did what I felt I needed to do to try to help my best friend and my husband. I started looking for answers. I would type in different phrases, trying to come up with answers for what it might possibly be. The bluish hue, or the temperature changes, or pain, or pins and needles.
Based on her research, and despite the fact that the doctors have ruled it out, Sheila thinks she knows the type of disease Mark has.
The symptoms that he was having seemed to relate themselves to a circulatory disease.
As a next step, she contacts Hillcrest Hospital, a well-regarded research facility 3 hours away in Cleveland, and makes an appointment with vascular surgeon Dr. Anthony Rizzo.
I could see the frustration in Mark's face. You know, not only did he want relief from the pain that he's been experiencing for the last 5 years, he wanted to know what was wrong with him.
He used his fingers and his hands to touch my feet, to feel for the pulses. No one had ever done that.
His pulses behind the knee were normal. His pulses in his upper extremities were normal as well, whereas his pulses in his feet were diminished. Just by my examination, I suspected that Mark had a serious blood flow issue to his feet.
Dr. Rizzo decides to perform a specialized test to take a closer look at the arteries in Mark's legs.
The test that I use is called PVRs, pulse volume recordings, and these pulse waves measure the circulation at different levels in his lower extremities. They were normal all the way up to the ankle. However, beyond the ankle, they were flatline.
But before he can make an official diagnosis, Dr. Rizzo has Mark walk him through his entire medical history.
He went through the history that we'd gone through so many times. He'd ask him about smoking, ask him about his work, he'd ask him about exposures, anything that might be a contributing factor.
Based on my physical findings and the fact that he was a heavy smoker, I knew he had Buerger's disease.
Buerger's disease is a rare disorder of the arteries and veins in the legs and arms. It's associated with heavy nicotine use, which can cause narrowing of the blood vessel walls, thereby constricting blood flow. As a result, not enough oxygen and nutrients reach the body's extremities, causing patients' circulation to be compromised.
It's an autoimmune process that is stimulated by smoking. Something in the nicotine or the smoke stimulates this inflammatory process. Buerger's disease does not occur among non-smokers.
Finally, I had an answer, and I knew I had to quit smoking.
Mark's symptoms were related to compromised blood flow to his feet, resulting in pain, severe pain at times. Mark had feet spasms because the muscles were not getting enough oxygen and nutrients. These spasms can be compared to a runner developing cramps because of lack of blood supply to that muscle tissue.
The shortage of blood and oxygen also caused his feet to feel hot and turn red.
Mark was experiencing burning in his feet because of the lack of blood supply to the nerve endings, particularly the sensory nerve endings. You get a red foot because it's the body's way of compensating for the lack of blood supply.
And the shift from hot red feet to ice-cold blue feet was a direct result of the disease as well.
When the artery constricts, the flow is almost completely occluded to that extremity and hence lead to coldness. The lack of oxygen in the blood can cause feet to turn blue.
After struggling with a crippling condition for more than 4 years, Mark and his family are relieved to finally have a diagnosis. But they can't help but wonder why it took so long to get one.
Buerger's disease is a very rare disease. In the last 10 years, I've only seen 3 cases. Mark was relatively young. Most physicians don't think that this individual should have circulation problems.
But the harsh reality is undeniable. If Mark had not been properly diagnosed when he was, his future would have been grim.
Mark's symptoms are like having a tourniquet around your leg below your knee. And ultimately, if you keep the tourniquet on long enough, the tissue starts to die. With enough tissue damage, it can lead to an amputation.
The first thing Mark must do to avoid any more damage is to stop smoking.
If Mark continues to smoke, he'll have close to 60% chance of an amputation. If Mark stops smoking, the likelihood of him having an amputation is low, less than 6%.
Although it's been a lifelong comfort, with his life and legs on the line, Mark gives up his nicotine habit for good.
If it wasn't for Dr. Rizzo, I'd probably still be smoking cigarettes today, and maybe with an amputation, that would be terrible.
It was very difficult for Mark to quit smoking, but I'm very proud that he did.
Although there's no way to restore the function that Mark's already lost in his feet, there are things he can do to improve his condition.
I also recommended that Mark exercise as much as possible. Exercise itself induces the formation of new blood vessels. It's very difficult for one to function with this pain, and hence, narcotics is an essential part in treating these patients. Today, Mark is much better. He has learned how to control his symptoms. I think if he continues to do this, he will continue to improve and hopefully be without pain one day.
We're looking forward to a healthier and happier future.
I try to ride a bike for exercise now. I push myself to walk. I feel now that I am strong enough to carry on with my life, and I will eventually get back to work. I will not let this conquer me. I have a will to live for my family, my children, and mainly just to beat this damn disease.